Do, 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 do. You want to hit it out of the park when it comes to your bookkeeping services? You need me, Dr. Friday Tax and Financial Firm. Full service financials, which means we help you with QuickBooks. We're certified QuickBooks advisors. Full payroll service. We can handle it all. Deal with the IRS? I'm an enrolled agent, which means I'm licensed to be able to deal with the Internal Revenue Service on your behalf. Full financial services. We can handle giving information to your banks. You need this information if you're going to borrow money or if you need to put more money in your pocket. We're the firm for you. Dr. Friday Tax and Financial Firm. We're on your team to help you save more money. Easy. Pick up the phone. Give me a call. 615-367-0819. Check out the website. It's got all the information. www.drfriday.com or just email me friday@drfriday.com. We're back with the Dr. Friday Show and my team of experts. Again, on my right, I have Barry Burke, Burke Business Advisors, and then right next to me, you guys all know this guy, Hank Parrot, Estate and Financial Strategies, a certified financial planner. Big difference than one of those little broker guys. You got to know the difference. Then on my other side, we have Denise Ruiz, which is my real estate expert, and Lee Barry, my attorney, and he deals with Kennedy Law Firm. So all these guys are here to talk about the health care bill. We know it passed. It's, quote, legal now. So what does that really mean to us? So let's kind of break down, guys, some of the different things that's going to happen within the bill. We've already covered the 3.8. We understand it has nothing to do with the home, but a lot to do with the business. What are the other things that we have in here that we might have? How about the health savings account? A lot of people don't know about, right? Is
self-employed.
Right, a lot of us have it. I have an HSA. I know, Hank, you have one, right?
We use it a lot because this is one of the areas when you look at the cost of health care, the premiums that have to be paid, in particular when you're self-employed. Self-employed, if you've got a family plan as an example, you're probably paying somewhere around $1,000 a month, and that's if you're using an HSA with a high deductible of say $2,500 to $5,000. So if you can take that money that you're for that deductible, put it into the HSA, basically at least you don't have to pay tax on being able to pay for the small health care costs.
Because as everyone knows, medical is really hard to meet on your tax return because you get that 7.5 your adjusted gross income. Most people just can't meet it.
Which is another one that they've changed.
Right, the flex spending, and of course they're bringing it up to 10. They're bringing that up to 10%.
So think about that. Now you've got, besides taking away the HSA part of it, okay, which would allow you to write off that $2,500 to $5,000, that first $2,500 to $5,000 you'd pay in expenses, medical expenses for that. Now they're going to raise this, the amount you have to hit in expenses before you can deduct anything.
Well,
so this is, again, that's like a 33% increase.
Yeah, and then the one that gets me is the Medicare, because that hits everyone. I mean, some people are going to think, okay, the employer, they need to provide me insurance, let them pay for it, no problem, it's going to cost you more in product, but that's okay.
Doesn't really affect them.
But it's going to affect them on this, on the Medicare, because now they've got to pay more out of their side of the check, the employer's got to pay more out of his side of the check, and at the end of the day, it's just more money going out of their check.
Right,
you know.
0.9%, and that really kicks, and again, when we talk about the self-employed, you know, I mean, all of us here at this table, or many of us are pretty much working to build our reputations and our businesses. Being in that level, we all have to cover our own insurances. We cover the matching taxes and all that. But even if you're employed, there's additional. But I still wonder how they're going to implement all of this. That's what a lot of people are wanting to know. They're sitting there. I mean, they're figuring out how are we gonna make this work? You know. So we've got the HSAs and of course the flex spending, which is almost going to be worthless.
Well, and then the penalty. Now, if you can keep, because this is one of the things that was a good selling point for the self-employed in particular, is that you could put in, let's say your deductible is $2,500. You could put $2,500 in for your deductible into that HSA, not have to pay tax, just as if you were putting it into an IRA as an example. Turn around, if you spend it for your medical expenses, well, at least you didn't have to pay tax on it. But if you had no medical expenses, which puts you in control, right? Do I have to go to the doctor? Well, if I don't really need it, I can get the over-the-counter stuff. I can save that $2,500. I can add another $2,500 next year. Keep building it up, and it's almost like I've got a little retirement account that I could potentially have if I don't have much in the terms of medical expenses. And now they're going to say if you withdraw that money for other than medical expenses, they're going to raise the penalty, the excise tax, from 10 to 20%.
Right.
Again, that's ridiculous.
Yeah.
Yeah.
Well, you know,
all
I mean,
And-
look at
and
what's
how about-
happening to investors.
Well, that's it. I mean, investors are going to get the worst,
Well,
and that's
that's-
one of the things you're going to really need to have a team of experts sitting down before you make. And the biggest thing I think with this whole panel, I always like to point out is you want to come to us before you make these decisions, okay? You know, as Lee has been known to say, talking to him, he's always like, people only come to me after the bad things have happened. So no one really, you know,
True.
we always tease about lawyers, but we only want them when we need them. But when the best
Something
thing is
bad's
to
happened.
come, exactly,
Yeah.
you know, is actually go to them now when you're thinking about how am I going to make this. Figure out before you take and sell out all your stock, thinking, oh, I'm going to put it under the mattress because I'm afraid of all this. And next thing you know, you've created this huge capital gains that you could have avoided, or you sold a house for what it shouldn't have been, or inherited, or a business you just basically
Right.
walk away from, or you don't do anything with
Well,
it
it
because
affects I mean, I know we got probably a wide variety of TV viewers out
Right.
there. You know, we're all self-employed, so we speak a lot from the self-employed viewpoint. But every private citizen is going to pay for this. So don't just think your boss is going to pay for it. You as a taxpaying citizen are paying for
I
this.
heard Obama say he is not raising the tax on the middle class.
Well, I'm looking
just
at
telling
2
you.
pages
That's
of
what I
taxes
heard.
here, so I don't know who's
Right.
paying for them, but
But well, that's the thing, and we all know corporations, right? I mean, what happens when you
Yeah.
increase their taxes?
cost of goods are going to go through the roof. Because the employer at the end of the day is in charge. And I always tell my guys, I slice the pie. So I'm going to decide what slice I want first, and then I'm going to divvy up everyone else's slices at the end of the day. That's the prerogative of being the owner. And so what we're going to do is we're going to have to raise the cost of goods. There's no employer out there that can afford $2,000 a year in additional invoicing on an employer's medical cost.
Right.
He's got to raise the cost of goods. So now you're not only going to pay more tax as a private citizen, you're going to pay more for your Big Mac. I mean, bottom line.
You know, it's worse than that. You've got the Medicare increase that the employer is going to have to match if you have people in the higher income bracket. You've got the hospitals and all of them that are going to have to increase their costs to cover the new machines and all that, because it's going to come down the line. So when you, instead of going for $1,000 or whatever it costs a day at the hospital, it's going to go up again, right? Because
Well, and then you've got the other taxes on, the $50,000 tax on charitable hospitals if they don't meet
This one's
a
it.
criteria of 85% in clinical services. You've got medical devices, so hip replacements, knee replacements, pacemakers, all of those things are going to be taxed. Now think if you're in
plastic
those
surgery.
industries, plastic surgery, but think if you're in those industries, what is that doing to that business in,
Right.
in terms of its competitiveness in the world?
Well, it's
If we
encouraging
keep
job growth for
raising
sure.
taxes, yeah, exactly. How are they going to compete? Is that going to chase more companies out of the country,
country.
And then the
basically,
stuff
that's-
to go do that
The
business?
stuff that's not on here, you know, if they don't do it correctly, the litigation cost, the cost
Oh,
of
the
attorneys
cost
start
of
coming
cost
into
of
it.
litigation.
The
That's
stuff
a really
that's
good
not
point.
on the paperwork, the
you know,
unintended
lawyers, they're
consequences.
always looking for something to sue
Yeah.
for.
Well, as
You
we
and
were
I
talking off,
before
Right.
about how many people are leaving the country for medical services.
Oh,
Right.
yeah. I actually have a lot of clients, especially ones that are from overseas, going back over there to do the different services. All right, so I'm being told that's enough of this exciting. If you guys would like to contact any one of the guests that's on my show, again, I'm going to run through the line here. We've got Barry Burke, Burke Business Advisor. His number is at the bottom of the screen. And then we have Hank Parrot, Estate and Financial
An
Strategies. And he's the author of 7 Steps to Financial Freedom in Retirement. And guys, it is an awesome book. I have actually physically read this book, so it's a really good one. It's going to help you. And then, of course, we have Denise Ruiz, the real estate. So if you've got a home or a business building or something you would like to find out what it's worth, you need to give this girl a call. And, of course, Lee Berry, that is our attorney. So if you want to sue somebody, call Lee. That's the best thing I can say. All right, it's been an awesome show. Thank you guys for all joining
Thanks,
me.
Friday.
Thank you,
And
Friday.
Thanks,
we'll
Friday.
be right back with the Dr. Friday Show. I sure hope you enjoyed the show. I know Herc and I had a good time showing you some of the information, and I'm hoping if you have any questions at all that you don't hesitate to email me and ask me the questions. That's what this is all about. I want you to stay informed. So email Friday@drfriday.com. Go to www.drfriday.com for more information or pick up the phone 615-367-0819, and don't forget the book.